Can you hear me, guys? Is this on? Working? Okay. We're going to start about 5 after. I'm going to do my best to try to do a question and answer session at the end. The key goals of this talk are to review PPE usage, donning and doffing, and make sure that you can be comfortable handling yourself when visiting a person under investigation. Is the video working, John? Thanks. Okay, let's go ahead and begin. My name is Mike Davis. I'm an internal medicine infectious disease faculty, and I'm going to do my best to, as of 3/16/20, give you some updated information on some specific topics around coronavirus and COVID-19 infection and policies in the hospital. And let me first start by saying there are a whole lot of things that are evolving in real time. And there are a few principles, infectious disease principles, I want to get into your heads, because even as individual policies evolve, our understandings of respiratory viruses are pretty consistent. My hope is that we can go pretty deep into personal protective equipment, which is really my goal for you guys who are on the front lines, is to be familiar and comfortable with putting on and taking off personal protective equipment in a thoughtful way. Because you guys can do this, and you are important in the response. Okay, so this is the game plan. I'm going to try to give you a case illustration which works its way through the Erlanger health system, from clinic or emergency department triage, through admission to the hospital for sick patients, through discharge processes and clinical follow-up. And a lot of these systems and processes are evolving. There is an intranet site at the EHS homepage. And as I go through the talk, all of the phone numbers are going to be highlighted in red. The phone numbers in the intranet site will not change, though the policies and procedures will evolve over time. So I would encourage you to take note of these phone numbers. The goal also is to look at personal protective equipment, and I've got a demonstration I'm going to do. First, I'll show you a video demonstration, then I'll walk you through a step-by-step approach on a slide, and then we'll do a personal demonstration. So by 3 ways, hopefully, we will be able to communicate this clearly. 2 key principles for PPE in this setting. One is this is a respiratory virus. It gets in your face, okay? Put that in your mind. Respiratory viruses get in your face, all right? So the goals are protecting your mouth, eyes, and nose. Another principle of PPE is dirty in the front, clean in the back. So as you're doing procedures, especially around doffing, removing PPE, trying to maximize the amount of removal from the back will help you. All right. I'm going to talk just a little bit about healthcare worker exposure, because those questions will start to become common as we go forward. And I also will refer you to this specific Erlanger Operations Command Center, who is your go-to location for updated information within the health system. Visual alerts, messaging that will be out and about in all of the outpatient centers that are coming in. This is the one that the CDC recommends in terms of stopping the spread of germs. These are all messages that you should know. I also put it in this slideshow because you're going to get calls from home and from family members and friends and wonder what are the mechanisms by which I can protect myself from community spread. These are the key ones for you to tell people. Cover your cough into the elbow, 20 seconds. You may be asked to put on a face mask. Okay. Triage. This is I had a meeting with the emergency department that finished 30 minutes ago. There is a current process to split patients into respiratory complaints or not, sick or not sick. If you have a respiratory complaint, you're sick enough to look like you're going to need a hospital evaluation, you'll go into an airborne infection isolation room and have a provider assessment. If you are an outpatient triaged, as of 3/13/2020, there are designated 3 sites as screening locations for Erlanger patients and associates with fever and cough. These locations are Erlanger Sports Health Institute in Morrison Springs Road, UT Family Practice across the street, and Erlanger Primary Care Volkswagen. These are the numbers to those sites. If you are concerned about COVID-19 exposure or want testing, you need to call them ahead. That's in the messaging from the CDC. Okay, but you're called now to see this patient. What should you do? Okay, so it is PPE time at that point, and that's the primary purpose of this talk. This is the number. If there is not a kit in front of the room that's designated for COVID-19 patients, call this number, 778-6436, for the Baroness Erlanger Hospital. I'm going to break here and show you 4 minutes on PPE.
The goal of this video is to review the PPE, Personal Protective Equipment, requirements for the 2019 novel coronavirus so that you can safely care for patients who have suspect or confirmed infection. We will now review the appropriate order for putting on or donning the PPE. Outside the patient room, or if present an anteroom, observe the isolation signage on the door and assess the PPE required. If needed, secure your hair. Perform hand hygiene, ensuring that the hand hygiene agent is applied to all surfaces of the hands. Put on your gown by placing your head through the top opening and inserting your arms through the sleeves. Do not place your thumbs through the loops yet. Tie the back of the gown securely, ensuring a secure fit. Place the N95 respirator over your nose and mouth and lift each strap over your head. Place one high, one low, as demonstrated here. Perform a seal check. Put on your eye protection. This can be goggles or preferably a face shield. Perform hand hygiene. Again, ensuring that all surfaces of your hands are in contact with the hand hygiene product. At this point, place your thumbs through the loops of the gown and put on your gloves. You are now ready to enter the patient room. We will next review the appropriate order for taking off or doffing the PPE. Gown and gloves may be doffed in the anteroom if present or inside the patient's room. Grasp the gown in the front and pull away from your body so that the ties break, touching the outside of the gown only with gloved hands. Pull the gown away from your body and roll into a small bundle, peeling off your gloves at the same time. Dispose of the gown and gloves in the trash and then perform hand hygiene. Once outside the room, remove and dispose of your face shield or goggles. Perform hand hygiene. Remove N95 respirator by lifting each strap and allowing the mask to fall freely from your face. Dispose of N95 respirator. Perform hand hygiene again. If you have questions, please contact Infection Prevention.
All right. Can you hear me again? So I came up with a mnemonic. It may not be the best one, but it'll give you the steps, step by step. Help get my society healthy, looking good. Hand hygiene, gown, mask, shield, hand hygiene, loops, gloves. Help get my society healthy, looking good. Follow those steps. Can you say it with me? Help get my society healthy, looking good. All right? Now you're in the room. Now you need to remember what questions to ask. You only want to go in once, right? So make sure you get the assessment part right. These are what were sent in Friday's assessment strategy for a positive screen using epidemiologic criteria or severity of illness criteria. This is likely to change. This is what it is today. Fever, signs of lower respiratory illness, and contact with someone with known disease, or fever and signs of lower respiratory illness and history of travel within 14 days to a level 2 CDC level 2 geographic area. Fever, lower respiratory illness requiring hospitalization without an alternative explanatory diagnosis. Those are your steps in screening. This is the message for today. Getting out of the room after you've done your assessment, here is a way to get out of the room. Gown and gloves, hand hygiene, door, shield, hand hygiene, mask, hand hygiene. Get going home. Don't stop here, my helpers. Say that with me. Get going home. Don't stop here, my helpers. Put that in your mind, okay? Then it gets to the provider order section. Some of this will be done in the triage process, but this is the set that has been published to us as of Friday. Order for negative pressure isolation if it's not been done. These are the PPE steps. I mean the PPE elements. Gown, N95, gloves, goggles or face shield, not Googles. Order the respiratory panel, sputum culture for adults, B&P for adults, adults chest CT, pediatrics chest X-ray. This is the communication step. Call the EROC Transfer Center at 9201. EROC will connect you to the infection prevention physician and or the on-call epidemiologist at the Tennessee Department of Health. That is their number. 615-741-7247. Go through EROC to make this call. Okay, so we're going to have a case. All right? Somebody want to be my, can somebody be my patient? Somebody down here. Drew, can you help me? Okay. He's not as old as I am. This is me, but he's going to pretend like he's me. Okay. So you're on the end of the desk because I've got a 6-foot table. Okay? So you're coming in with a chief complaint of cough and fever. All right. He's a 38-year-old physician from the U.S., returned 10 days ago from Wuhan, Hubei province, China, 3 days of symptoms immediately upon arrival. So he would fit the clinical criteria for a patient under investigation. The first thing I do is say, welcome to Erlanger. Please put on a mask. And I would triage him to the negative pressure room, which is this side. You can sit right there, 1 and 2. From triage, see, this was his physical exam, but we put a mask on him, so it's not it. Now I'm going into the room, okay? Can you guys do this mnemonic? Help, hand hygiene, get, you won't have this to deal with. Help get my society hand hygiene my basic evaluation, right? He already screens positive based on the triage exam. I'm doing my exam. I'm listening with the in the room stethoscope. I'm not taking anything in the room with me. I'm not taking anything out of the room with me. Okay? Now I've gone out of the room and stopped at the door. Pretend I'm still standing right here. All right, while you're still in the room, there needs to be a trash can right next to the door. Your patient is in the bed with a mask on. The trash can next to the door gets you. Get. Going, hand hygiene. Home, door. Other side of the door, don't. Hand hygiene again. Don't stop here. My helpers. That's the end of the story. You're now ready to come out here and do your very best. Provide orders Reviewing them again. Negative pressure isolation, respiratory panel, sputum culture, BNP, radiology orders. Call that transfer center, and they will direct you in terms of testing through the epidemiology physician. And thank you, Dr. Hinson, for being such a good sport. One of the things we'll need to talk about going forward are discharge criteria for people with COVID-19 infection. These are the current standards. Patients stable enough to discharge. Caregivers are available at home. They have a separate bedroom living space, access to resources for food and necessities, and PPE for patient and caregivers, and a risk assessment for the household, which includes no other household contacts with severe comorbid illness. It's a high bar to try to jump through if I think about the discharge requirements of a lot of our patients. Home care for those who have exposures or who do not require hospitalization. Stay at home. It says to avoid contact with people and animals, call ahead for appointments, wear a mask, and do other routine hygiene procedures, clean your touch surfaces. For those who will be discontinuing isolation, the current standard is to have 2 negative PCRs taken 24 hours apart. Okay. And then to healthcare provider exposure. This was updated on March the 7th. And there is, even since then, some new information about what to do in the settings of exposed healthcare providers in the setting when provider staffing starts to be an issue. A high-risk exposure is defined by close contact, which is 6 feet over a, quote, prolonged period of time, which is defined as greater than a few minutes, with bilateral nose and mouth open, okay? Those are high-risk contacts. The patient's mouth is not covered, nose and mouth, and your nose and mouth is not covered. That's a high-risk contact. Medium risk, same space, same time. Patient is masked, the provider is unmasked. Or a face mask rather than an N95 during an aerosol-generating procedure. Low risk, healthcare provider exposure, 6 feet, shorter prolonged duration with incomplete PPE, which includes a mask or respirator, but nothing else, face shield, gown, gloves. What do we do for healthcare provider with contact with a patient who was wearing a face mask? If the patient was wearing a face mask, the healthcare provider had none on, it is a medium risk exposure, exclude from work from 14 days after last exposure, or not wearing a face mask or respirator, a medium risk exposure. Your mouth and your nose are the primary points of entry. That's true of all respiratory viruses. Healthcare provider not wearing eye protection, low risk exposure in a patient who was wearing a face mask, not wearing gown or gloves, low risk exposure, wearing all recommended PPE except the face mask instead of respirator, low risk exposure. Prolonged close contact with a patient who is not wearing a face mask, healthcare provider PPE none, it's a high risk exposure. Not wearing a face mask or respirator, high risk exposure. Not wearing eye protection, a medium risk exposure, but a risk of that includes active monitoring, excluding from work for 14 days after last exposure. Not wearing gown or gloves, low risk. Not wearing all recommended PPE except face mask and respirator, low risk exposure. These are guidelines that are in evolution and will be communicated to you through the healthcare organization called Workforce. If you think you have had an exposure, the Workforce number that you call for more information. What is the most important PPE? And hygiene is the most important PPE.
This conference is being recorded.
understand how to prevent transmission through the appropriate use of PPE and understanding something about respiratory viruses. Also, we can understand what the exposure risk is relative to your nose, mouth, and eyes. And don't come to work if you're sick. That is the end. All right. I'm going to keep these things up, and I will try to do my best to answer some questions. There are a lot of unanswerable questions out there right now, but I will do my best for you guys. Go ahead.
We don't know if they're actually have the COVID or not. They're in isolation.
So you're reusing the masks, is that what you're saying?
Don't do that anymore. Okay. Oh, please repeat the question. In the setting of the ICU of people under investigation, is it okay to reuse masks and or face shields? And I would recommend that at this point you do not reuse them.
Just warning on the doors that are not in 95 masks, you're saying they're out of them on the floor, just surgical masks.
Mm-hmm.
Is that appropriate, or?
There's an evolving recommendation that allows for surgical masks in this setting. We believe that the primary route of transmission are large droplets, greater than 5 microns, which would make surgical masks an appropriate PPE. That's a hard recommendation to roll back on, but stay tuned. Dr. Saba?
So for discharge, they have to be negative on PCR 24 hours.
To be removed from isolation,
They can be discharged while.
they can be discharged from the emergency department. If they're not sick enough to come into the hospital, they're not requiring a level of care from inpatient providers, then they can be discharged to home care, but would need to remain in isolation until that second PCR comes back negative.
We have a patient clinical picture fix.
Mm-hmm.
We run all the tests
Mm-hmm.
and but the first test was the COVID test came back negative last night.
Mm-hmm.
If the next one comes back negative, we take off the isolation.
Yes. The question was, if the patient tests negative for COVID-19, do you remove the isolation precautions? The answer is yes.
Yeah, testing the 2 times, is that only for someone who's already tested positive? So if your first test comes back negative, do you repeat that at 24 hours?
I think it depends on your pretest probability. I don't have a clear recommendation on that.
And setting the patient with leave AMA. We had one that was very close. Didn't want to participate, wouldn't wear the mask. She never read the lead, but we had it on our radar. We didn't know whether in that case.
I don't know the answer to that question. I will ask that question at the. Dr. Hornsby.
If I'm sick, in the,
Healthcare provider.
if you're still sick, don't come to work. I feel like it's thrown around.
Yeah. That is also a moving target. The EHS communication that came out on 3/13, which should have been provided to all of you, say if you have a new fever or cough or respiratory symptoms, shortness of breath, that is a definition of sick. Yep.
In allergies. All right, just ask.
Stay tuned. Look at the EHS intranet site. My sense of things right now is that we're making the screening really, really sensitive and not really, really specific. As that impacts the workforce that's available to take care of patients in the hospital, that will be updated regularly.
So I feel like we have much people in ICU that may not be the risk factor for travel, but that doesn't mean anything if we're not testing anybody in the U.S. So we don't know who's tested positive or not. So that factor does not eliminate us from testing people who negative, respiratory negative, is still requiring their heart pressure. You know, we're getting so much pushback, and it's like, what are we doing?
You'll probably get less pushback as testing becomes more available, I would guess, which should be rapidly.
Okay. I'm going to take this conversation offline now. If you want to come and kind of practice through a couple of PPE don and doffs, that might be to your benefit. Thank you guys for what you do. Stay tuned for updates. Thanks.
There is any plan to utilize the commercial labs?
Yes, we're using.